Hi, everyone. Looks like Dr. Chloe is here. Hi, Dr. Chloe. Hi, Soumi.
Hi.
Okay, we're going to start. Quick intro. My name is Lisa. I'm the founder of Ivy Tutors Network. We've been working with New York City students to help them reach their academic potentials and also find the joy in learning for over 17 years. We're starting our 18th school year now. But this year is not like the rest in any way, shape, or form, right? So that's what part of our conversation is about. Today was a big day. We finally heard from the DOE, and it looks like school opening is delayed. 9/21 for in-person and a week sooner for remote school. Lots and lots of changes this year. Some private schools are all remote. Some are 100% in person, some are hybrid, most are hybrid, I would say. And why we're here today, within all this mess, parents have choices too, and it's hard to know what's the right thing to do. So we all have many questions about what's best for our families from physical and psychological perspectives. And so I feel very lucky to be joined by Soumi, who is a former professor of public health and a former surgeon, and most recently the founder of Cleared for Work. I'll let him talk more about it, but this is a platform that we use at Ivy Tutors Network to make sure all of our tutors and students have a documented health screening every morning. And more. We're also lucky to have Dr. Chloe Carmichael with us. Dr. Chloe earned her PhD in clinical psychology, and she is in private practice, and she's the author of a new book I'm personally really excited about. It's called Nervous Energy: Harness the Power of Your Anxiety, and you can pre-order it on Amazon. So I think the way we'll work is I'm going to ask our panelists the big questions that you saw, in our in the description of the webinar, and then we want to leave lots of time for people to ask their specific questions as well. I guess one more thing, just a little disclaimer. While I think our panelists are very knowledgeable and brilliant, they're not giving you personal medical advice, right? So obviously for medical advice specific to your family situation, we recommend that you seek advice from your doctor. Do you guys want to give a little intro, or should we jump into the questions?
Well, thank you so much for inviting me. And I have thought so much about the topic of school and COVID and quarantine from so many different levels. I think it impacts all of us as families, as individuals, as students, as couples, as parents. And my hope for tonight is that we're going to have an open space to unpack this together. And Soumi, I'm really excited to learn from you as well. And Lisa, I want to thank you for putting the panel together. And if you have experiences to share too, I'm super excited. I hope you will.
Thanks.
Thank you. Absolutely.
And thanks, Lisa, for having me here tonight. And Chloe, I'm looking forward to hearing your comments as well. And just to give a little bit of background, so yes, I was a trauma surgeon, and now I run a software company. Our current product of relevance is Cleared for Work, but you should also know that we've branched it out and made it Cleared for Class, which is particularly important for this seminar. And so what the Cleared for products all do is they give you a symptom monitor, and they make sure that when you go to a specific place, the workplace or a school, and we're even building it out for travel and fans for stadiums. We have right now 5 stadiums we're partnering with. And so what it does is it does multiple things, one of which is including, it takes away the legwork from a lot of the administrators in documenting symptoms. We all want to make sure everybody's safe in our workplace, and this will make sure that they are documenting it so people aren't tabulating loose papers and wondering if somebody was sick last week, who was at the office with them, and if somebody's coming in, a visitor for the day, and they want to make sure they're okay and they're not going to spread anything. And we also have a way to build in vaccines and tests, and so then and I'm sure this will come up somewhere, is where we are in the vaccine situation. And I'll bring that up, but I'll say ahead of time that in things like that this will be very important for your workplace and your school to know who's been vaccinated and who hasn't. It seems like it's so far away now, but there are vaccines that may come out in October or November, and it'll be very important for everybody to keep track of who's received what. So I look forward to the discussion, and I think we'll have a great time. Thank you.
Great, fantastic. And if you have a question, there is a little chat button at the bottom of your screen. Oh, sorry. I apologize. The Q&A, they look very similar. It looks like two little talking bubbles. If you would just write your question in there, and we'll get to it a little bit later. So the first question that we have here is just, what are the things that families should be considering when thinking about sending kids to school, part-time or full-time? What are the most important things? I guess this one's for both of you.
Sure.
Well, I'll jump in. So I think first and foremost, the thing we all want to make sure we're taking care of is our children's health, whether it be physical or emotional. There are so many levels. And of course, each child is different and each family situation is different. So the answer as to, which things we should be thinking about first and foremost, I think are going to depend on the child's needs. But what I think also should be part of the conversation is the parents' needs. And I think sometimes it's hard for parents to know exactly what is the healthy role and way for their needs to be a part of it. And they sometimes feel like, oh, well, it shouldn't be about me, it should be about my kid. And that's true. And certainly if your child had some significant situation where it needed to be one way or the other for them, that has to take the ultimate priority. But what I'm trying to also share with parents, because families have gotten closer here in more ways than one, and with closeness there's friction, is that there's a healthy way for parents to actually also model their needs and say, for us, we have this need and we are working as a family to take care of each other. Can you work with us on this? And I know that's going to be different, obviously, for children of different ages as well. There's so many factors. So I don't think, as Lisa says, it's not a one-size-fits-all situation.
Definitely.
Sure, and I can add to that. So as Chloe mentioned, everyone has to be safe, and you can put the situation into the workplace, the home. In Lisa's tutor group, you're in your home or potentially in a neutral site. And wherever place you're going to, it has to have several basic principles. I know we've all heard most of these, if not 100 times over, but I'll just recap some of the important ones. It has to be a clean space. The people around you have to be healthy and free of any communicable illness. As you see, everyone's thinking about COVID, but in about a month or two, you're going to start thinking about the flu season as well. Not that people need more to worry about. I didn't mean to bring that up, but that is an issue. You should all get your shots and make sure and talk to your doctor, make sure if you're eligible. There are some people who aren't, obviously, but everyone should be getting their shots. What we don't want in the fall flu season is people coming in with flus that are more than normal in number, and then that'll be muddying the waters of who needs COVID tests and things like that. So that's something very important to consider. And I think the CDC is already starting to make people realize that, in that this should be the year everybody gets a flu shot, not just 50 to 60% like it is in other years, because the ERs are potentially already busy enough, and you want to minimize it as much as possible. And so you want your workplace or school or classroom to be safe and clean. And there's a lot of other things that are the responsibility of the person who's setting it up, like if it's a neutral place or if it's a school or a class or whoever's home people are coming into. And depending on how it's set up, my understanding is that sometimes people are even rotating their tutor pods and things like that at a different place every week or whatever. And because there are family issues, as Chloe mentioned, and not everybody can leave their house or sit or be there every time. So there's a lot of things and a lot of shared responsibility. You're talking about already, people are getting closer as families. The communities in some ways will have to be closer once we start getting out into it more.
Yeah, definitely a clean, safe space, trying to make sure that everyone who you come into contact with. It's impossible to make sure, right, that everyone is healthy, but you can wear a mask. You can wash your hands very often. You can always have hand sanitizer on you. We know these things work to protect yourself, for sure. What about parents who have to go back into the office? I know there's a lot of concern about that, and kind of, increasing the risk through exposure to office mates.
Sure, I can talk about that, because that's where Cleared for Work started. We were actually designed for offices. I worked in an office for a couple of years, and I understood the layouts, and you have cubicles and you have spacing, and nowadays at most offices in New York are not even back there. The ones that are 20 to 30% in our experience, and there's plenty of space available. And I think as long as that's in that league, everything's pretty much fine at work. You are having spaces. However, what we're hearing more and more of is that the offices are coming back to 50% by October in many cases. And that's just going to make things more challenging. And and what Lisa's saying is right. Everyone is a potential vector, and we all know that if if somebody is harboring something, they can give it to somebody else. What they're also finding out is even though they've only had 1 or 2 cases of people reinfected with COVID, they are finding more cases of people who potentially could be transmitting it, even if they've had the disease once. And so that's just something to be, but it doesn't really change anything. It just means you take precautions, you wear a mask, and you keep doing that. You use a sanitizer, wash your hands regularly. And I think people have been pretty good about modifying their behavior. And I mean, you've all read about some of the colleges that really have not been doing that, but in Manhattan and New York, it's been pretty good that way. And I can stop there for now, and if you have more questions.
Yeah, I've heard from families, well, if I have to go back to work, does that mean I should keep my child home from school? Does that mean that we shouldn't do in-person school this semester? Or does it mean that we should, right? So there are lots of ways of thinking about it. And from a psychological standpoint, both things are a lot of change for the family, right? Having had parents at work at home for 5 months now for some people, and then having that change of going back to school, of going back to work. Should we keep the changes separate? Should we do one change at a time? I've heard a lot of those questions. Do you guys have thoughts on that?
Sure. Yeah. I mean, that's a great question. And, I actually have been thinking a lot. I did a live stream actually on the topic of, it's called On the Horizon, as we think about the transition and some of the struggles and challenges that people are thinking about. So it is available for free on YouTube somewhere. If you Google, Chloe Carmichael on the Horizon, transitioning from quarantine. But I do think that every environment, of course, is going to be different. And I hate to keep hearkening back to that, but I do think it's important to remember that the context in which it's experienced by the family, that a parent is returning to work, and that the children may be returning, to in-person school, or the children may be doing remote while the parent goes to work. That's a dynamic I've heard about a lot lately from parents that are, as Lisa said, going through something that's a big change, which hasn't happened probably before, which is the situation of the kids doing remote. And one of the greatest concerns that I see parents having is fear of responsibility over this child's education, that the parent is working and they can't supervise that the child is staying on task, which is part of what a live classroom environment provides. So, different families are doing different things. I know Lisa and I have talked about her program, I think, that actually provides supervision, support services. I've also, known of people that have hired someone, you know, just to be present as kind of like a school day nanny, school marm, you know, to kind of just keep
Absolutely.
everybody on task. And I don't want to underplay, you know, the potential importance of that. I was a yoga teacher before I was a clinical psychologist. And in yoga, we think of the three jewels in Buddhism as the Buddha, the Dharma, and the Sangha. And the Sangha is the community. And we say that without the community, it's really, you don't get the full benefits. And I think it's, you know, true. We can have an online community. Look at all of us right now. But I think it may be that younger children especially may need someone. And I hope that parents don't feel like they have a false choice, you know, between doing what they want to do or need to do in terms of the office and providing support, because whether it be through getting an extra set of hands there in the house somehow, or even through that extra phone calls, other helpful things I think are to make sure everyone who comes in contact with your young child, and with the older kids too, actually for this one, ask them, what are you learning in school? Tell me about it, you know, and not to focus. I would kind of, if you can, try to ask your friends to maybe, you know, be there to listen and ask if the child wants to talk about remote learning, but to try to maybe broaden the academic discussion beyond the fact that it's remote learning, and see if you can help grow the child's, you know, sense of identity and pride as they talk about school in a little bit of a normal way. I could go on and on. So I'm going to pause here, but I just want to say I think it's a great question, and I do go on and on in my top, on the horizon free webinar.
Oh, great. Okay, we'll definitely send everyone a link to that. Thanks, Chloe. Soumi, do you have thoughts on kind of, you know, not everybody can choose whether they go back to work, but there is a choice on how you do school this year, you know, whether kids are staying home or doing a hybrid model, or for some schools there's
this is going to be challenging in a couple different ways, because what we're seeing from the offices are that they're giving a lot of flexibility to their workers. They only want to have right now 25%, and I said some are going up to 50% by October, November. And some actually have said you don't need to go back until January, depending on the nature of the business. I mean, I'm talking the office model. Naturally, as a doctor, and you know, you're there as much as the hospital needs you, and you know, that's a different ball game. And same with nurses and other healthcare professionals, essential workers of all types, and we can't forget those. But what we're seeing is that the offices are offering more flexibility than, in my experience, the schools have, because the schools are trying to coordinate all the children. And so some of the ones we're in partners with will be having, you know, 4th and 6th grade on Tuesdays and Thursdays, and then, you know, 1st and 3rd grade on the different days. And I'm sure that's very challenging for the parents, because then each week they may have to go to work and try to balance how they're doing it. And they may have, as Chloe mentioned, an external person, a sitter, or whoever is helping out. And you have to really balance multiple schedules to try to see what day the children will be there, what day the parent may have to go to the office. There's 2 parents sometimes that you have to juggle multiple schedules. And so it will be challenging. And a lot of times, and you know, we have to all keep in mind that it may be fluid. So we've already seen how multiple schools, none of the ones we're partnered with, but a lot of schools have already closed. And around the country, we've seen I've seen reports of at least a couple dozen have closed temporarily for COVID infections. I mean, again, and so the threshold is different for every school. So some schools, if they have 1 or 2 infections, they'll close a class, and other ones requiring a certain critical number. So everyone's school may be different. And, you know, as Lisa already announced that the New York City schools will be September 21st, that may be a moving target too. So there's going to be a lot of challenges, and the learning challenges, I'm sure, will be very important to the parents for a lot of the reasons that Lisa and Chloe both described.
I wanted to share just a couple of other like little practical tips too on that topic. I shared a little bit about with the younger kids especially, but for the older children, what can be helpful too is to, if it's just not feasible for someone to be home with them, but yet they're suddenly going to be home alone, you know, during the school day. What you can also try is, if you or a relative, or even a, you know, kind of 1 hour type job, is if a family member or someone can have an appointment with them that at 4:30 on Thursdays, and, you know, each day has a person assigned to it, that child has an appointment with somebody that everybody knows to do a screen share where they submit their homework portal. And I know that that can feel, kind of like, you're babysitting me or whatever, but you can make it fun by saying, if you have it like every single time with no issues, like for a month, then you can offer some kind of a reward. And, you can also be open and do what we call in psychology to narrate your experience and share with the child, I get it that you don't like to feel like, somebody's babysitting you, but as your parents, this is scary for us. This is new for us. If we're going to err on the side of one or the other, we want to err on the side of being a little bit in your business. And so we just want to see that the homework is getting submitted. And if you do it like every day for a month, then maybe we'll drop it. But like, can we just try it to stay on track? Or maybe every day for a month is too extreme for your child, maybe every other day. Sometimes the homework portals will show like a accrual list of any outstanding assignments. Again, not a one-size-fits-all situation, but the screen share can sometimes be your friend if the child can be accountable to that with an appointment with somebody that everybody knows and trusts.
That's a great idea to kind of, wean them off having somebody else be responsible for the reminder, right? And try and start to shift the responsibility onto the child. It's a great idea for, I think, middle school students around
with the agreement and the understanding that if the child no-shows or isn't ready, that the responsible person is going to email mom and dad and give them a no-show, like, that's what happened.
Right. No, I love that idea. Awesome. So you both mentioned, having a tutor or childcare or, other kids in the house, and a lot of questions on how to make that situation as safe as possible and as stress-free as possible. So if people are planning either a pod or to have a tutor or a childcare worker, what are the do's and don'ts? How do we make this a really safe environment?
Right. Well, for lack of any, no one's getting COVID tested before they do these pods. I mean, they might, but then they'd have to keep doing them on and on. So what we found in our school model is it's very hard to keep up on the testing. I know some colleges are doing the pool testing, like Cornell. One or two of them tried to do that and did not do as well. But so the point is that you have to respect everyone else. And if someone is sick in the family, you shouldn't go to your pod that week or that day. I mean, because
absolutely.
the odds of you carrying something are pretty high. And that's why, that's one of the principles behind Cleared for Class, is that we ask how the domestic contact's doing, because that's just as important as how you're doing. If you want to be safe, and again, it is a community, and we don't want anybody to miss out on anything, but it's better for everybody in the long run if somebody's sick or somebody around you is sick, that you don't try to interact with other people. And I think we're getting great buy-in on that concept, because I think everybody by now knows that, yes, that totally makes sense. I don't want to be around someone sick. Even if I had COVID before and I believe in the immunity, I don't want to pass it to somebody, or I don't want to be exposed, or I don't want to take chances, or
so how does that work? Sorry to interrupt, but I thought you are making such a good point that I want to make sure everybody's clear on how that works with Cleared for Class or Cleared for Work with your platform. So if somebody, enters their temperature and then are asked the health questions, and it actually turns out that they're not cleared for work or cleared for class, so they're not feeling well. Do others get notified who are in the same class? Or
so that's a great point. So that is set up. So in schools, there's always somebody in who's overseeing the symptom monitoring. So in schools, what's happening typically, we're seeing, is that if, say, you're in fourth grade and one fourth grader is extraordinarily sick, and let's fast forward, let's say it's a month down the road and everybody's been in school already for a couple of weeks. And if somebody were in school for a couple of weeks and your classmate, in your fourth grade classmate is ill, the administrators can do it one of two ways. So they can set it up so that whole class goes home for a week, or they can just have the ones just around the child go home who are within 6 feet. And it's really up to their discretion because we don't know always the physical structures of the classroom. What would I recommend personally if it was my child in that class? I'd probably say, everyone's been learning from home for 4 to 6 months. So if a week of safety is probably not a bad thing. What gets complicated is not just the homeroom class, is if you also have other activities and other cross contaminations of other different cohort groups. And so that's one of the reasons that the schools are doing, in our experience, much less sports this fall. Because that would have been just another way for the cohorts to get all muddied. And, there's these different concepts, and I won't bore you too much with just the basic. And there's horizontal spread of infection and vertical spread of infection. So horizontal spread is everybody in your kind of sane grade, think of it that way. And vertical spread would be in other grades getting involved, which can happen with siblings or teachers or sports teams and things like that. And that just spreads it much more. And so you always try to minimize the vertical spread. The horizontal spread you can't always do a lot about, but that's just one of the different strategies you can look at.
So if one person in your pod or in your class doesn't feel well, doesn't mean that they have tested positive.
Right.
Or does? Are you saying if they tested positive, everybody stays home, or it just if they feel well?
So, right. So, Lisa, that's a great question. So the optimal situation is if they have access to testing, they get tested and everybody knows.
Okay.
But we all know that the testings are, the antigen tests are coming around, and that's a separate topic that I'll be happy to talk about if people want to talk about it. But as of today, there is a 4 to 10 day lag in New York State for testing. And that is crazy from a infection control standpoint, because you can control yourself for 1 or 2 days to not leave the house and not interact with people, but to doing it for 10 days, especially if a child has really high expectations. And so what people are doing is, and this is one of the reasons the mayor is probably delaying school, is because it's so hard to keep control without testing everybody regularly. And testing really has to be under control for school to be in session safely. Otherwise, you will be sending so many people home all the time on a regular basis. And again, this is without the flu season coming in and symptoms muddying the waters.
Right. So I guess your recommendation is for everyone to do a symptom check and a temperature check every morning. And if anybody has any of the symptoms, everybody in that group or in that class should stay home.
Yeah, and it's a difficult to ask. It's easier to ask for a pod for 4 to 6 people than a class for 20 to 30 kids. And that's a decision each school will have to make with the parents in that community. And because again, and Chloe can talk about this, what's the social setback of missing a week of school, especially if you've already missed so much school. So, I mean, there's social, physical, educational, there's so many different setbacks. So it's really a community-based decision. Right.
And the back and forth, I think, is also hard. I've seen a lot of we obviously speak to a lot of families who have made the decision to keep kids at home this semester so they call us because they're looking for an educator to work with their kids to support them in the remote school environment. So either the school has said, oh no, we're remote only, or the school has given them an option. And if they've said, no, we're really much more comfortable with remote only. And what's interesting is, a lot of the time that's as much a psychological, it's a decision based on psychological health as much as physical health. I've heard parents say, my kids just got used to remote learning. They just got used to this way of doing, of being, of handing in work, and to go back for a month and then God forbid there's another outbreak or something, and to be shut, back and forth. Or let's say there is a 4th grader who is sick, and everybody has to stay home for 2 weeks until there's clarity or until the tests come back. There's that component of it as well.
But you see why the testing is important, because you can abbreviate that time while the decision is being made, if you had testing with good turnaround.
Okay, and you think and testing is reliable enough at this point?
Yeah, it's for the most part, yeah.
I actually have a question for Soumi as well. You mentioned a 4-day turnaround time. I'll share, I was actually tested once myself and I was negative. And my test, was in a few hours, but that was at a different time, I think. But I have heard that we now have what are called rapid testing
All right.
centers, and you can get your results like really quickly. And I have, can you speak to that, Soumi?
Sure. Sure. So there's basically three types of tests. There's PCR tests, antigen tests, and antibody tests. I'll give a blurb on all of them, and I hope I don't disappoint our audience, but I'll be quick because some of this may be old news to some of them. But I'm sure if Chloe, as Chloe's asking, because there's a lot of new information all the time. So yeah. The standard is the PCR test. These take usually 1 or 2 days in a lab to do. So you get a swab, usually in the nose, and it takes 1 or 2 days in the lab to do. It is considered the most reliable test. It is uncomfortable to have the nose swab. And the reason it's been taking, so it usually would take 2 days in the lab to do, but lately the labs have been so busy, they've been sitting on a shelf in the lab waiting for the machines. They can only run a certain amount per day, and they've been taking sometimes 3 to 5 days, even 10 days in some places. I'm not saying in your anybody's listening's neighborhood in New York City, because New York City's rate is so low, the city is so low now that and there's not as many people there who are getting tested regularly. Maybe that's the holidays. But in parts of Long Island for sure, and that's what people are telling me. So that's the PCR test. They are the standard, but they can take a few days to come back. The antigen tests are the rapid tests that you're probably asking about, Chloe. And there's been a couple big announcements. Abbott just came up with a big announcement the last few days that they are shipping 50 million rapid antigen tests in October that will help the community. The government just bought 150 million of these tests. And the beauty of these tests is, again, they seem to be wonderful. They take 15 minutes. They have 97 to 98% accuracy, which is much better than the previous generation of antigen tests, including Abbott's antigen test, which was found to be, had a lot of problems in May when it tried to launch its first test. So this test is quick and does have rapid turnaround. But again, like anything else, the more great things you'll hear about it, the less available it'll be for the average person, because everyone's going to want to try to gravitate to these tests. And yeah, they will be able to be helpful. And hopefully there'll be enough of them to go around, is all I can say. Just so you know that these tests, the antigen tests that Abbott made and the previous ones, are approved for diagnosis of COVID, not for asymptomatic screening. So there's a difference. And this is relevant to school and pods and tutors. So there's been, and people have asked me, like, before my second grader goes to school, why don't they have the whole school checked and then everyone's clear, then we don't have to have any breaks if somebody gets new COVID. Well, the truth of the matter is the test is only good for that day. And the other truth of the matter is you really can't go through, or one of our schools in Long Island has 3,000 kids. So you can't go through 3,000 tests, even if you do it every other day a week. I mean, it would just be a very difficult strategy to try to adopt for the average school. Maybe there's a couple schools out there that could think about it. And, I know at least one private school that is doing very frequent testing in their kids, but that's not the norm for all the schools. And then the last test, I'll say one word about, is the antibody test. And that tells you if you've been infected in the past. And usually to do that, you have to wait 2 weeks after the time of infection. So I hope that answered your question. It was very long.
Yes, thank you. Thank you so much.
Yeah, very informative.
I do think it's really exciting. I just want to say, I as a psychologist, I always think it's important that we celebrate our victories. I think it increases momentum and engagement. And in depression, which I'm not saying anyone here is depressed, but I know some people have found, this to sometimes feel depressing. And in depression, we worry about what's called cognitive dampening, which is where we almost lose our ability to see the positive. And what Soumi just shared, about the rapid testing, I think is really exciting. I've seen people now able to come and go, like from the country, because they're able to make that happen. And I just think that's a lot of good news about 150 million tests, or, I didn't quite catch that number, but it sounds, I just want to celebrate that good news. I think it's really wonderful that we now have access to that information quickly.
Yeah, I
And
agree.
yeah, just one last point on that. Roche is also coming up with another test that they're approving in Europe. And so there'll be another antigen test coming to the United States in October that, again, will be a better generation test. And, that would be the best thing, to have a 5-minute test. You don't have to wait to go to a lab, and you can do a lot of, you know, well, presumably it's going to be approved for screening. I think they'll work just as well for screening and surveillance as it does for symptomatic people, which is a different conversation, but because there's less virus when you may be asymptomatic than when you're symptomatic. So if it can pick up the worry is it shouldn't be used for asymptomatic people because it may only need a high viral load to pick up the symptomatic people. But I think these tests are pretty good and will work in all those cases, as studies will hopefully show over the next month, and we'll have reason for the optimism that we're seeing.
We'll have reason for more optimism, for
Yeah,
even more celebration. Yeah. So you mentioned that, that it's not feasible for a large school system or for a school to be testing every other day because the test is only good for that day. How about a pod situation, or a situation where you're inviting a tutor into your home, or a caregiver of some sort? Let's say, I guess in an ideal world, maybe we identify a test site nearby where the family lives, and what is the ideal? Is it once a week testing? Is who gets tested? What do you recommend?
Right. I think it's going to be a moving target depending on the availability of the tests.
Right.
And so I think maybe if we fast forward 4 to 6 weeks from now, I think it will be reasonable to get weekly testing for the tutor, and I guess anybody else symptomatic in the cluster group. Because then by then they wouldn't have to quarantine everybody, because they could just test them, and if they're negative, then they're if they were light symptoms. They were heavily symptoms, I would probably wait on that, but that seems plausible.
In the case of no symptoms, would you still recommend weekly testing?
Well, I think that will be done by the community and the prevalence rate of the disease in the community. So, for example, right now in New York City, I mean, you have to look at the numbers every day. And I should say, New York City is not the same as upstate, so you can't look at the state numbers. In some states you could, but I think New York City is pretty.
Let's talk about New York City.
Yeah, I think you have to look at the city numbers. And again, what I'm reading is the neighborhoods are still very different. So Midtown, like the Upper East Side and Upper West Side, have different COVID rates than parts of Brooklyn, Queens, Bronx still. And so even specific neighborhoods within those boroughs are considered much worse. And some of them have 3% positivity rates, whereas Manhattan is 0.5 right now. So it's very variable. So maybe in some of the communities where it's higher, then yes, you probably would need more frequent surveillance. But in maybe a community where it's low prevalence, then you wouldn't, is probably how it's going to end up working out. And that'll probably go for schools too.
Right, because if there's a 0.5 infection, rate, then I just to make sure that I'm understanding properly, that means that the chance of somebody getting it is so low.
They're very low.
Yeah.
Okay. Let me just tell you about that number. So this is what the number. So everyone's hearing what's the infection rate, and so it's been a number in the last 6 months. Between New York was 25% in March, and now it's 0.5%. Now, what that number means is the number of positive tests that occur with people that were tested.
Oh, wow.
Okay, let's just think about that. So think of all the tests that are done in the state or the city in a given time period. Usually it's a day. And that's the denominator. And the numerator is number of tests that are positive. So I think the other panel members and the smart audience members will say, well, that seems like a manipulated number, because if you test a lot of asymptomatic people, the number is going to be a lower positive rate than if you test a lot of symptomatic people, right? And so in March, that means so many people were not tested who were probably positive because they didn't have enough tests to go around. So that number is 25%. That means, that means 1 in 4 people they tested were positive. That's just a really high number. You want that number to be somewhere in the 1 to 5% range. If your community, less than 1%, they say to go back to school. And so if you're only testing asymptomatic people, that number is going to be really low. But if you're testing a lot of symptomatic people and the number is low, that means the rate is really low for the community. So
much lower than 0.5.
Exactly.
Half of a percent. Yeah.
Right, exactly.
Yeah. Okay. Well, there's something else to celebrate, right, Chloe?
I was thinking exactly that. Yeah. So at 0.5%, then we're well below even, the low 1% gold standard, So I just do think it's really important when we have anxiety to be able to put boundaries around it. And so recognizing these types of reference points, I think is a really good neutralizer for the spinning wheels anxiety that can happen for some of us. And we may have kind of even needed to transition that part of ourselves too, because back in February, March, when, a lot of this was first dawning on us, we didn't know anything. We didn't have supplies. There were more unknowns, etc. And we kind of then shut ourselves into our homes, and now we're starting to foray out. And on a certain level, I think we're kind of expecting to return to where we were before, and almost bracing ourselves for that. But the good news is, as Soumi is sharing, and as I think on a certain level, we all live and experience that, that we're not really in that initial period of disorientation, and that things are getting better.
Yeah, and I can add one other tiny nugget of good news is that so one of the other metrics the state government is using to, we all hear about these quarantines, people from other states. And so what that means is the infection rate is more than 10 per 100,000 for the state gets quarantined. So if they visit New York, New Jersey, Connecticut, they have to be put on a 14-day quarantine. So there's about 30 states around the country that are higher than 10 per 100,000 in prevalence. And, New York has not been in that level for probably about 6 weeks now. So that's a good news for our state, and in that we're the ones restricting visitors and not the ones that people are scared of.
Definitely good news. I have one question here for Soumi about whether you were referring to a saliva test from Abbott.
Yes, I was the Abbott test is a rapid antigen test, and that's the one, the Binax test is what I was talking about. Yes.
Okay. Okay, great. And I guess to everybody here, we're just going to keep talking, and unless you ask your questions by typing it in there where it says Q&A. So please feel free. There's also a little button that lets you raise your hand if you like, but please type your questions and we'll see them right away. Otherwise, we'll just keep going through the questions I have here. So what is the next one? I guess we've touched on this a bit, but I'm curious, and I'm hearing this from families a lot, what are the specific precautions we need to take when inviting, I guess we just did go through this, child care workers and tutors in the home. We talked about whether testing is necessary, and I guess if we said if there are no symptoms present, we're so low right now that it probably doesn't make sense. Obviously still masks, right? Lots of hand washing for a classroom setting or a larger pod, or if any teaching indoors. 6 feet apart is still the gold standard, Soumi? Yes. And masks.
There was some article that came out that it should be longer or further away, but that's really what the CDC is recommending. So I have nothing to say that contradicts that. Okay, great. And from the perspective of anxiety, Chloe, like you said, we've been hermits. Our communities have gotten so small that now that we're starting to invite people back into our world, whether that's going back to school and seeing your friends, or having kids over for a pod, or having a tutor a few times a week in your house. Are there some things that you want to caution about, or things that people should do to prepare themselves for that opening?
Sure.
Yeah, go ahead, Chloe. You go ahead.
Okay. Sure. Um, I think, yeah, as Lisa, as you were saying, it is a time where anxiety can feel high as we're, coming out of our time where we've been in this intense quarantine for so long. And that can include social anxiety as well. So even just going and, being around a group of people when you haven't done that in a long time, it can almost feel, like you're socially awkward in a way that you didn't necessarily feel before. And there's also the issue that if everybody is in a mask, just on a certain knee-jerk level, I think many of us associate that to, medical danger, anxiety. Moreover, of course, masks stop us from getting normal social cues like a welcoming smile or, certain forms of facial gestures. So it's almost a triple whammy in terms of, just the out of practice isolation, and then the medical mask thing, and then being deprived of the ability to have, your normal face-to-face contact, which for little ones, again, I think is especially important. And so I can really understand many parents that may, just weigh all of those factors differently as they think about their particular neighborhood and what works for them in their particular family. But when you are, whether you're a child or, an adult, and maybe even you want to model for your children some good social behavior in those situations, you can try to scan for signs of social acceptance, because on an unconscious, almost automatic level, I believe our rejection sensitivity can get heightened in those types of environments. And that's when that kind of negative internal monologue or nervous feeling starts and people can shut down. So to give yourself a cognitive way to just force yourself in a light way to just latch on to stuff that's going to be reassuring and bridge building and pro-social, maybe challenge yourself to think of, 5 signs of social acceptance. And that can be somebody calling to say hi. It can be somebody waving. It can be like some kind of an eye gesture. So then you're starting to notice, are people trying to make eye contact with me? And you're starting to look in a new way, which, unfortunately, for I'm not sure how long, appears to be a part of life. I think also there's issues around uncertainty and other things that can be really hard for people to deal with. So one of the things that I've been writing about and talking about is thinking about your way of framing uncertainty to yourself. I work with mostly very high functioning people. And for us, so to speak, us meaning people who are intelligent, driven, goal-oriented. A lot of us, when we experience uncertainty, interpret it as a signal that there's more research we need to do, or that maybe we're missing something, or that, we're behind somehow. And that can naturally be an uncomfortable feeling. The healthy function of anxiety is to stimulate preparatory behaviors. So we might be used to feeling healthy anxiety when we're uncertain because it means we need to do more digging. But in this situation, it's unique because uncertainty is actually the appropriate emotion. Nobody really does know some of the things that some of us may feel like we're trying to guess. And so if you struggle with uncertainty, I just encourage you to silently repeat to yourself, uncertainty is the appropriate way to feel right now. Uncertainty is the appropriate emotion right now. That can just help to normalize it. And it can help to remind you that you can stay grounded where you are. So, there's, I mentioned that technique as well as the social scanning technique. But the good news is that there are a lot of really good ways that if we put our minds to it, we can think about these issues of anxiety. There's also the topic of secondary gains, and I have some interesting thoughts on how those things connect. But I won't go on and on, except just to say that if anyone does want to connect with me on social media or any other ways, I love these types of conversations. So Lisa, thanks again for just organizing this.
Yeah. Oh, thank you for your great answers. Yeah, I love what you said about about cues that help normalize the situation and take the anxiety out of a situation. You know, I've noticed in my group of friends and family, as we've started to do like socially distanced outdoor hangs, there's the elbow bump, right, that everybody's doing. And I think that's a good example. And if you know, if you're if you are doing a pod at home, or you are learning with a group of kids in some way, maybe there's like a secret handshake or something that makes you feel like you're all in this together, which is the truth. We are all in this together. Everybody's going through this. So I think that's
so true.
Yeah.
That's so true. And there's one more piece of self-talk that I do encourage people that are struggling with, you know, either negativity or social anxiety in those situations to think about, which is just to silently say to yourself, we're keeping our distance because we care about each other. And that just helps to keep your mind on the right and the accurate fact, which can be helpful in those first forays back into the world.
Awesome. Yeah, absolutely. We have a couple of questions here. We have an educator asking, what do you guys think about someone who wants to work with two families or two sets of two pods within New York City? How safe is that?
Well, so I'll go back to a couple of things I said, and know that, you know, in the big picture, you never are 100% safe, of course, I have to say that. But there's a few things going for us that are good news, as Chloe will be happy to hear. And that is that the prevalence rate is low, and the communities are very committed, I think. I mean, I've seen in New York City and in parts of Long Island where I visit, is that the communities seem to be very cognizant of the safety measures of masking and distancing and hand washing and sanitizing. And I think that's why the rate became low and stayed low in New York City and in New York State. So that's good news. I'll answer your question. And again, it's, you have to know the family, you have to know the rate, you have to know if the people are of an ilk that are committed to having, you know, safe spaces. And again, this will address one of the other questions I just saw, like, can you have visitors indoors? I'll put that in the same category. You have to know the people you're having to visit. I mean, we already want, you know, a certain standard of people are visiting us, and they have to now check a couple extra boxes. They have to be somebody who you think would be committed not to be harboring symptoms, that they would be using sanitizer and minimizing the risks around them and not taking risks. And, you know, you may not have the same numbers of social individuals in your sphere as you normally would, but the ones you have should be ones you're comfortable with being around, and you have to know them in a couple other extra ways. And then that last question is, will outdoors be the only way to socialize? Well, I think the CDC would always say that outdoors is safer to socialize, but, you know, New York City winters aren't always the safest, funnest place to socialize. So again, it's I think you will be challenged to really think about who you're hanging with, and think about the community prevalence is probably one of the most important things. And you may decide that you have to ask more questions to people before you interact with them. And it's, and again, Chloe can comment on the social natures of that interaction, but it's I think it's going to be, for now, probably a little extra thing you'll have to do.
Right. Like
Thanks, Soumi.
Oh, please.
Oh, sure. Thanks. I just wanted to agree, you know, Soumi, that I, of course, I do have thoughts on the social part of it. And that is, of course, a part of public health as well, is our social interaction, our social support networks, and our mental, you know, health and well-being, and, you know, maybe our need for domestic support. As I know we discussed a lot of the stressors and educational goals, you know, that we may have, as well as needs for social support if it is a New York City winter. You know, and as well, I really like what you said about people, I think, basically using their own sense of judgment and common sense about who they would want to have in their home? And does this appear to be someone who is maintaining a level of cleanliness that feels appropriate, right? And that at a certain level, there's no, litmus test, at least, so to speak. Maybe Avid is working on it, but until that point, many of us are going to have to, at a certain point, rely on our common judgment and not have to feel as if we always know every answer. I think that's kind of a setup for pressure. At the same time, I really love the idea of putting a lot of thought and discussion into the topic to really give yourself a chance to think it through so that you can really truly use all of your senses when you think about these questions.
Yeah, I'll just add that that at Ivy Tutors we are starting to do in-person tutoring, and we're comfortable, or some tutors are comfortable, and some families are comfortable with that for many of the reasons we've mentioned, and including the very low infection rate right now in New York. And Soumi's wonderful platform that allows everyone to self-screen in the morning, put in their temperature. Everyone's alerted if anyone in the group or the tutor has any symptoms at all. So there's this kind of transparency that I think is super important from social and educational whether it's a social interaction or an educational interaction. And of course, also we mentioned this, but just lots and lots of sanitizing and keeping the spaces clean, airflow whenever possible, right? Open windows whenever possible. Maybe less possible in the winter, but for now. Okay, I think it looks like we've answered all the questions. Just want to make sure we got to everything that we promised we'd get to here. I guess the last questions were really about how to create homeschool pods, and this is something that we'll send out contact information after this, but it's something that I can talk to people about offline. I know Chloe mentioned that she'd be happy to speak offline as well. But about the homeschool pods, these are conversations that I'm having every day with families. Most families are choosing to be in pods with people they've either been socially distanced with or that are part of the same staggered school schedule that they're going to have in school. So these are kids that they're seeing in other scenarios, and so they're minimizing risk that way. A lot of the pods are starting outdoors at least, or in a really well ventilated area. And of course, as we mentioned several times, we're taking lots of precautions, with using cleared for class, and a lot of sanitizing and hand washing. The last one was just advantages and disadvantages of group learning. I think that's quite a big topic. And I think we touched on this quite a bit throughout. Group learning, meaning sending kids back to school versus learning at home in front of a computer, in a remote, doing remote school. I think there are advantages to both. It really depends on your child. A lot of families had told me that last semester the remote learning did not work very well for their kids, and they missed having some kind of social interaction. That makes a lot of sense. We all, I think, miss social interaction. So if it makes sense for the family and it's possible to either have a situation where they're doing remote learning in a group, or there are a few families that they feel comfortable creating a learning pod with, and having that be their learning scenario this semester, I think that's a great option. And for some families, going back to school is a great option too. I know the schools that are opening are doing so hopefully because they've set up a safe place for kids to go to school, you know, and they're taking it really seriously. So it's not going to be in a public, you know, public school where you sometimes have 30 kids in a classroom. That's not going to happen this year because the desks need to be 6 feet apart. So, you know, it will be with a lot of safety precautions, temperatures being taken when you come in the morning. And hopefully hopefully your school district is using Clear for Class, so it's all documented and clear for everyone to see what, you know, who's sick and if anyone, and what's going on. I don't know if do you guys have anything to add? Any closing thoughts, advantages, disadvantages of going back to school? Anything else?
Well, sure. I mean, sorry, Soumi, go ahead, please.
No, I was going to say, I think the kids I've talked to all can't wait to go back. And I thought I would never hear it when children are saying, I want to go to school, I want to go to school. And I mean, when I was a kid, we rooted for snow days, you know, so this is a different world we live in now.
Absolutely.
I agree. I mean, yeah, there's so many aspects from a psychology perspective, of course. There's, you know, social modeling issues. There's the fact that many people find screen time to be draining at a certain point. You know, and there's the issues of, you know, parent-child interactions and the need sometimes for a little bit of breathing room, so to speak, which I know is quite a touchy topic right now. So, Lisa, I just want to thank you again for organizing this.
Thank you, Lisa. Yeah.
Thank you guys for all your wonderful answers and for being here. It was really great talking to you. Great.
And anybody can email me if they have any questions, and yeah.
Wonderful. We'll get contact info out. I know Chloe mentioned, you know, we mentioned her book and another YouTube video that she has that I'm sure people will be excited to see. So we'll get all of those links out to everyone. So any follow-ups are happening in a timely manner. Thank you so much. This was wonderful.
Bye-bye.
Here.
Bye.